Good afternoon. Welcome to Thursday Reading Live. This is me, Vandana PS, joining you from Neetu's Academy. Okay, so majority of my students have this concern regarding whether it is possible to crack reading part A within the stipulated period of time. If it is possible, then how? Okay, so let's look into this cracking part A as well as part B. So first of all, I'll show you a sample question from part B, then we will discuss the answer. Okay, so let's look into a material. I'll give you 2 minutes for preparing this question, then let's check the answers. Okay, so welcome back. Let's read the question, then let's look into the correct answer. Okay, so what is the question? This extract informs us that. Okay, so question is, in the question, as you can see, nothing mentioned about in which category the question falls under. So could you please comment in which category the question falls under? All right, yes, so this comes under the category guideline, the first category. Okay, so this question comes under the first category, guidelines, because it is already mentioned in the paragraph. Okay, not in the question but in the extract. As you can see here, this is a guideline. Okay, guidelines, oxytocin. So this extract informs us that. So first of all, it is very important to mark keywords from the question. Okay, so what are your keywords? I'm just marking only one word, that is informs. Okay, so option A, the amount of oxytocin given will depend on how the patient reacts. So my keywords, oxytocin, depend, reacts. So from option B, the patient will go into labor as soon as oxytocin is administered. So my keywords, labor, then again oxytocin, administered. Then option C, the staff should inspect the oxytocin pump before use. So my keywords, staff, should, then pump. Okay, so what are your keywords? Let me know in the comment. Okay. Hi Abhi, Divya, yes, Banu, good afternoon. Okay, Banu, yes, this is a guideline, very good. This comes under the first category, guideline. Even though it is not mentioned in the question, it is very clearly mentioned in this paragraph, okay? Yeah, this is a guideline. So what are you reading for in a guideline? So what are guidelines? What are guidelines? Guidelines, which means it includes a set of principles or instructions, okay, recommendations that someone has to follow. So, in the guideline, we are looking into or we are reading for details. Okay, so which sentence is important in a guideline? So, I can say always the first sentence is important. I'm not saying that first sentence is the answer, but still, the first sentence will give you a lot of clue towards your answer. Okay. So, option A, the amount of oxytocin given will depend on how the patient reacts. So, let's read the passage, then let's look into the answer. Okay, so extract from guidelines, oxytocin. Oxytocin dosage and administration. Parenteral drug products should be inspected visually for particulate matter and discoloration prior to administration whenever solution and container permit. Dosage of oxytocin is determined by the uterine response. The dosage information below is based upon various regimens and the indication in general use. So from the first line itself, you can eliminate which option? Any clue towards any of the options can be eliminated. Okay? Parenteral drug products. So which means should be inspected. So in option C, as you can see here, there they have mentioned should inspect. Okay, but nothing mentioned about pump, oxytocin pump. It's all about medication products or drug products. So there is no connection with option C. We are eliminating option C because it is not mentioned anywhere. Regarding what? Regarding should inspect. Okay. Then what about the next line? Dosage of oxytocin is determined by uterine response. So from the second sentence, I'm just tracing my answer towards option A. Yes, the amount of oxytocin given will depend on how the patient reacts. And as you know, part B is all about paraphrasing. So what do you mean by paraphrasing? Which means there will not be any change in the meaning, but the sentence structure will be different. So here, the second sentence can be connect with, okay, or it is associated with the first option. Then the dosage information below is based upon various regimens and the indication in general use. Then induction or stimulation labor. Intravenous infusion or drip method is the only acceptable method of administration for the induction or stimulation of labor. Accurate control of the rate of infusion flow is essential. An infusion pump or other such device and frequent monitoring of strength of contractions and fetal heart rate are necessary for the safe administration of oxytocin for the induction or stimulation of labor. Okay, then if uterine contractions become too powerful, the infusion can be abruptly stopped and oxytocin stimulation of the uterine musculature will soon wane. So wane, which means decrease. Alright, so yes. What about this one? So nothing mentioned about, once again I'm saying this, nothing mentioned about this oxytocin pump and should inspect. Okay, so again we are eliminating that same option. What about option B? The patient will go into labor as soon as oxytocin is administered. So nothing mentioned about the patient is going to labor as soon as oxytocin is administered. So again not mentioned. So our answer is option A. The amount of oxytocin given will depend on how the patient reacts. Okay, which is paraphrased in the second sentence. Clear? Okay, a lot of comments. Okay, Marin, hi, good afternoon. Yes, Yogeshwari, your answer is correct, option A. Okay, Shija, excellent. Hi, Reba, good afternoon. Yes. Okay, so that's all about part B. And I would like to just revise regarding part B. Okay, so we have total 6 questions in part B. And regarding this 6 questions, to complete this 6 questions, you will get maximum 10 to 12 minutes. Okay, because there is no separate time for doing part B and C. Collectively, you will get 45 minutes. Okay, 33 minutes for part C and 10 to 12 minutes for the completion of part B. And we have 6 questions. And about the 6 questions, I can say it will be like, multiple choice questions with 3 answer options. And then comes a paragraph. a respected paragraph will be there. So it will be very easy for you. Just read the question, read the options and read the paragraph, then do elimination method, find out your answer. Okay, so to make it easy, what you have to do is do an additional material every day. Okay, we are uploading a lot of materials in our Telegram group as well as in this page, in the respective page. Okay, so that's that. So now let's move to the next part, that is part A. Okay, so we have a new topic. Okay, so let's discuss. So before moving to the topic, let's revise or let's condense about part A. So what do you know about part A? Okay, so as I already informed in the beginning, majority of the students have this concern regarding, is it possible to complete this part A within 15 minutes? Yes, it is possible. How it is possible? Okay, so for that, we have to follow certain strategy. Okay, a particular strategy, and that strategy can be called skimming and scanning. Okay, as you know, within this 15 minutes, we have to complete 20 questions and we have to skim and scan through all these texts. Subtext, okay, text A, text B, text C and text D. Okay, so almost you can take 2 minutes for reading all these texts. Okay, not only reading, it's very important you can scan through the text. While you scan, you have to mark certain keywords from each of the text. Clear? Okay. Then, so what are the keywords that you will mark from each of the texts? And text A will be different from text B, it will be different from text C and entirely different from text C, which means every text will be different from one another. Okay, and one of the texts will be a pictorial of something, like any table or a chart or or a diagram. So one of the texts will be a pictorial. Then, so what are the keywords? Coming back to, what are the keywords that you will mark? So you can read whatever you want. If you know the language, if you know the words, you can read whatever you want. But still, here in this particular module, while you do part A, it is very important while you skim something or while you skim through the text or fast read the text, you have to mark certain keywords. So what are the keywords? Okay, so for that, you can mark all the headings, all the subheadings, all the numbers. So whatever number they have mentioned, you can mark all the numbers. Maybe sometimes they will mention the numbers in the form of words. Okay, for example, TEN, 10, that is a word, but it indicates a number, right? So likewise, you can mark all the words which indicate number as well as the number, the figures itself. Then the fourth point, all that signs and symbols, not symptoms, signs and symbols. Okay, so what are the signs and symbols? For example, as I already mentioned in the previous sessions, a greater than is a sign. Percentage is a symbol. So likewise, it's very important to mark all the signs and symbols. And the next one, all about the names. Okay, I can say proper nouns. So maybe name of a country, name of a disease, name of a person, name of an equipment. So whatever names they have mentioned in each of the text, it's very important to mark everything. Okay, and sixth one, all the abbreviations. Okay, so what do you mean by abbreviation? Yes, acronyms, which means the short forms. As you can see here, PFPS. In the first text, it is PFPS is an abbreviated form of the particular disease condition. Okay, so likewise, you can mark all the abbreviations. Then, the words which is mentioned in all the brackets. Okay, you can mark all the brackets. Then, eighth one, all the words which are mentioned in italicized or bold letters. Okay, the ninth one, the words that indicate time. Okay, so time showing words are really important. Why? Because when you read each of the text, you can see a lot of words that indicate the current or the present scenario, the time. For example, now, currently, presently, previously, during, after, before, a lot of words that indicate time. Okay, and the next one, the word that indicates experiment. So what are the words that you know which indicate experiment? The word itself, experiment, clinic or clinical observation, identification of something, diagnosis of the condition. So A lot of words that indicates experiment, as well as the words that can be connected with research topics, population, study, okay, expense. So likewise, you can mark all the words that indicate research. And the 12th one, okay, second last point, I'm not saying you have to mark it, but just give special focus while you skim and scan. Give us special emphasis or focus to all the first and last line of each and every paragraph, as well as the bullet points. That is the 13th one. Okay, clear? That's that. Okay. Okay, Shija, you have a doubt regarding, is it okay to do text B and C first, then go back to text A? Okay, dear? So, according to my perception, okay, I'm not saying that you can start with text B. It's better you can start in that proper order. Okay, because you'll get confused. Actually, as I already mentioned, I have no idea whether you have seen the previous session. So, whatever, yeah, I'm saying this. So, if you are doing additional materials, you can see that, okay, in text A, text B, text C, and text D, definitely these texts will have a particular purpose. Okay, for example, text A will be the information, okay, regarding a particular disease condition. For example, a topic is necrotizing enterocolitis. Suppose imagine, okay. So maybe text A will be, or text A contains all the information regarding the definition of that particular disease condition. What is necrotizing enterocolitis? What are the symptoms? Okay, so if you're skipping that portion and if you're starting with text B, maybe in text B it's all about the prevalence. Okay, and in text C, yeah, maybe one of the pictorial, and in text D, all about the outcome or the treatment measures. So it is better, okay, it is my personal opinion, it's better you can start with text A, then text B, text C, and text D in the proper order. Clear? Okay. All right, so that's that. Now let's read, or now let's look into the text. So skim and scan. So what are the keywords from text A? Could you please tell me what are the keywords from text A? Yes. Okay, a lot of comments. Reba, okay, headings, subheadings, number. Okay, italicized letters, bold letters. Okay. Okay, so that's that. So my keywords from the text. So the topic is patellofemoral pain syndrome. Patellofemoral pain syndrome. So that is the topic. So the word itself, I'm marking the name of the syndrome, patellofemoral. Then the abbreviation PFPS. Then the bracket. Okay, again the abbreviation. Then the name of this bone. Okay, then the name of the muscle. Then muscles, tendons, ligaments. Then again patellofemoral, the medical term. Okay, then the bracket, again the short form. Okay, so these are the keywords which I am marking. Okay, yes, so these are my keywords from text A. I just skimmed through the text and I have marked all the important words. From text B, again you can do the same. So what are the keywords? Okay, so there are some issues mentioned. Okay, so these are my keywords from text B. Okay, so now I'm moving to text C, and here comes a pictorial. There is a table. So yes, enrollment, criteria, measurements, then all the numbers, abbreviations, okay, signs and symbols, brackets, everything. Okay, then the last, again the title, subtitle, the bullet points, like a lot of points mentioned. Okay, everything I'm marking. Then okay, so that's all about. There is no abbreviations mentioned here, but names mentioned. Okay, so these are my keywords. So that's that. Now let's look into the questions. So the first set of questions, which is 1 to 7, can be called fill in the blanks, right? No, it's match the following, okay? So 1 to 7 set of questions that can be called match the following. Then, so what is the instruction mentioned here? For each question 1 to 7, decide which text, whether it is A, B, C or D, the information comes from. You may use any letter more than once, okay? And second set of questions, which is 8 to 14, that can be called short answer questions. Okay, so what is the important instruction from there? You can write it in a word or a short phrase, which means maximum 3 words. So what is a phrase? As you know, phrase which means combination of different words. Okay, but short phrase which means maximum 3. And in the third category, that comes fill in the blanks. Okay, the same instruction, you can write it in a word or a short phrase. Okay, so that's all about the pattern or the type of questions. So the first question, how many people were able to complete the study? So what are your keywords from the first question? Okay, Reba. Okay, Ida, PF, PS. Okay, the abbreviation, right? Yeah. Okay. Okay, so tell me, what are the keywords from text A? What are your keywords from text A? Okay, Marin, already you got the answer. Okay. So my keywords, people. Okay, before that I'm just marking how. Okay, how, people, complete. So these are my keywords, and I have seen that in the pictorial. Okay, here comes the participants completed the study. See the last box. Okay, so participants that completed the study. So that particular term is mentioned, the keyword. Okay, so while you do part A, the only thing that will help you is your keywords from the question as well as from the 4 texts. Okay, the keywords are gonna help you. So that answer is from text C. Second one, okay, Reba and Jansi, very good, text C. Second question, what is the advantage of taping while you are preparing for exercise? So the keywords advantage, taping, exercise. So where they have mentioned these keywords, advantage, taping, exercise. Okay, so the taping, advantage, exercise, which is mentioned, as you can see here, in treatments. Okay, in treatments, what is mentioned here? Taping. There is a point, taping. Your physical therapist may show you how to tape your knee to reduce pain. Okay, so that taping, that particular medical, the keyword which is mentioned in text D. So don't waste your time, okay, while reading everything, each and every detail. Just skim and scan and find out your answer, because we have only 15 minutes. So always keep it in your mind. We have only this much stipulated period of time, so within this time we have to complete 20 questions. Okay, then question number 3. The probability of patients to have PFPS if they have knee pain. So probability, then PFPS, knee pain. So these are my keywords. So probability, PFPS, knee pain. So which is mentioned in text A. As you can see here, see the last line, PFPS. That is one of our keywords. Then another thing, knee pain. So PFPS is very common. Experts estimate the probability that around 1/3 of people who visit healthcare providers with knee pain have PFPS. So our answer is text A. Clear? Yeah. Okay, Sushma, it's not text B, dear. It is text A. Okay, the last line. Okay, Jansi, Aparna, Marin, Tenzin. Okay, very good, very good. Okay, fourth one. Which are the different types of surgical interventions conducted to treat PFPS? So the keywords, different types, interventions. So any idea in which texts the fourth question falls? Which are the different types of? Okay, so different types which is mentioned in text D. So what are the different types? So what are the different types mentioned? Okay. Yes. Okay. So that is from text D. The treatment, the different types of treatments mentioned there. So which is from text D. Clear? Okay. Yes. Okay. Sure. Yes. Okay. Okay, Marin, it is from text D. Okay, Reba, text D, Tenzin. Okay. Then fifth one. What are the main functions of patella? So what are the main functions? So my keywords: main, functions, and patella. Okay. So my answer is, which is from text A. So from my memory, I have seen that patella, which is mentioned in text A. See the second point, your patella is the bone at the front of your knee joint. It helps your quadriceps muscle move your leg, protects your knee, and supports lot of important muscles, tendons, and ligaments. Okay, so the answer is from text A. Then sixth one, the link between the shape of the patella and the occurrence of PFPS. So the link, shape, and PFPS. So any idea? Sixth question. So the link between. So what is the link between the shape? See this last line. The natural shape of your knee. If your patella is naturally an unusual shape or doesn't fit into the groove in your femur as it should, you might develop PFPS without any stress or strain in the knee. So that answer, which is from text B. Seventh one, the factors that increase the risk of PFPS. So what are the factors? Again, it is very clear, the same text, the factors. So some factors or issues that may increase PFPS include, so what are the factors? So these are the factors. So again, our answer is text B. Okay. So where did you get that text A from? Sushma, Binsi, Merin? So the last question, the factors that increase the risk of PFPS. Okay, it's not from text A, actually it is from text B. See, clearly mentioned the factors that can lead to, which means that can cause PFPS include. Okay, then next one, eighth one, cite 2 examples for knee-friendly exercise. So again, exercise is one of my keywords, then knee-friendly. So where they have mentioned this exercise, knee-friendly exercise. So what are the examples for knee-friendly exercise? Which is from text D, the treatment. Okay, knee-friendly sports mentioned. Okay, so these are the knee-friendly sports. What are they? During recovery, it might help to stick to sports that are easier on the knees, such as bicycling or swimming. So what are the examples? 2 examples, bicycling or swimming. Yes. Okay, Tenzin. Actually, your answer is correct. Okay, bicycling. Okay, it's not bicycle, dear. It's bicycling or swimming. So don't write bicycling and swimming. Whatever they have mentioned there in the paragraph. So please, write that particular thing. I mean bicycling or swimming, not bicycling and swimming. And which means combination of 2 different words. Here it is not a combo, it is actually separated. Bicycling, either you can do bicycling or you can go for swimming, not both. Okay, so which means not bicycling and swimming, it is bicycling or swimming. Clear? Okay, so the answer is bicycling or swimming. Yes. 9th one, a pencil tin device that is inserted into knee through a tiny cut in the skin is called dash. So what is the name of the pencil tin device? The name of the device, that is again from the treatment. Okay, the device called an arthroscope. So in the previous line very clearly they have mentioned, during this procedure a surgeon inserts a pencil tin device into the knee through a tiny cut in the skin. So that name is arthroscope. So either you can write arthroscope or you can write an arthroscope, because the articles are so important. Okay, so answer is arthroscope. Then 10th one, the alternative title of patellofemoral pain syndrome. So what is another or alternative title for patellofemoral pain syndrome? That is from text A. See, what is another name? It is sometimes called PFPS runner's knee. So you have to write the full thing, PFPS runner's knee. That should be the answer. Yes, Sunu, it is PFPS runner's knee. Very good, dear. Okay. Okay, Jansi, actually I know that particular word is mentioned there. Okay, but here it is a name of the disease condition, alternative name of the disease condition. So you have to write that name. And one thing is that they have not mentioned the full form there. It is the abbreviation, PFPS runner's knee. So just write that abbreviation plus runner's knee. Okay, yes. Okay, then 11th one. How many sessions were carried out along 3 weeks in the RF intervention? How many sessions? So we need a number. How many? How many sessions? So it's all about RF intervention. So as you can see here in text C, RF intervention is mentioned here in this box. Okay, so how many number? The number which is 10. Okay, 10 sessions. So number is how many? 10. So answer is 10. Then 12th one. The weakness of which special muscle? We need the name of the muscle. Which special muscle? In the leg around the knee might not be able to support your knee as they should. So the name of the muscle. So what is the name of the muscle? And that is from text B. Answer is, okay, here they have mentioned quad muscles. Okay, so the name of the muscle which is mentioned here, weak or tight muscles, and under the same line, answer is quad muscles, especially your quad muscles. If the muscles in your legs around your knee, in the bracket, especially your quad muscles, so that is the name of the muscle, are weak, they might not be able to support your knee as they should. So answer is quad muscles. Yes, quad muscles. Okay. 13th, the bone that helps your quadriceps muscle move your leg, protects your knee, and supports lots of important muscles, tendons and ligaments. So what is the name of the bone? The bone that. So we need the name of the bone. So that is from here. The name of the bone is patella. Okay, so when you write the name of the bone, it is patella. So answer is P-A-T-E-L-L-A, patella. Okay, then the last question from short answer. Which drug had been injected upon the patients previously which made them ineligible for the study? Okay, so which drug? So we need the name of the medication, which drug, as well as study. So where they have mentioned the study, it is in text C. So where is the name of the medication? As you can see here in this box, the second one, previously treated with. So the name of the medicine is corticoid injection. So answer is corticoid. Okay, answer should be corticoid. Don't write corticoid injections because the word itself is mentioned there. We are injecting, injected. So answer is corticoid. Okay, so now we are just jumping into the last set of questions, which is fill in the blanks. So 15th one. Keeping the knee from moving inward while squatting is a main goal of dash. So what is the main goal of that answer? So which word or which words are missing? Okay, keeping the knee from moving inward while squatting is the main goal of dash. Okay, so where is it mentioned? Any idea? What is the answer for the 15th question? Please let me know. keeping the knee from moving inward while squatting with the main goal of dash. So where is it mentioned? Where is it mentioned actually? It is mentioned in text D, the treatments. So so the first point, rehabilitation exercises. Okay, certain exercises strengthen the muscles that support the knees and keep parts of the leg in line. Keeping the knee from moving inward while squatting is a main goal. So what is the answer? Which exercise? It is rehabilitation exercises. Yes. So answer is rehabilitation exercise. Okay. Then 16th one. Experts estimate that around 1/3 of people who visit healthcare providers with dash have PFS. Okay, around dash. So what is it? Okay. Answer is knee pain. Very good. Which is from text A. Answer is knee pain. It is mentioned in the last paragraph. Okay. Yeah. It is knee pain. PFPS is very common. Experts estimate that around 1/3 of people who visit healthcare providers with knee pain. So answer is knee pain. Yes. Very good. Okay, 𝐕𝐻𝐻 baby. Knee pain. Okay, 𝐉𝐮𝐧𝐞, okay. 𝐉𝐮𝐧𝐞, okay. Okay. Then. Okay, 𝐉𝐮𝐧𝐞, 14th question. 14th question, answer is corticosteroid. Sorry, corticoid. Corticoid should be the answer from text C. Okay, here comes. Corticoid. In the right side, first box. Okay, I'll show you once again. Corticoid should be the answer. Clear? Okay. Yes, okay. Yeah, then 17th one. Doing the same kind of motion often like dash, a lot or working on your hands and knees might cause PFPS. So what is the missing word here? 17th one. So that answer is from text B. Okay. So which they have mentioned? Jumping. Okay. So from the second point, very clearly it is because of jumping. See, overusing your knees, doing the same kind of motion often like jumping. A lot or working on your hands and knees might cause PFPS. So answer is jumping. Jumping can cause. Okay, Sunu, Binsi, Neetu, Jansimol, Aparna, Marin. Very good, very good. Jumping. Yes. Then 18th one. Dash is the medical term for the connection between your patella and your thigh bone, femur. So what is the answer? Dash is the medical term. So dash is the medical term, which means only one medical term mentioned here. That is patellofemoral. Patellofemoral is the medical term. So answer is patellofemoral. Okay. Then 19, second last one. You might develop PFPS without any stress or strain in the knee if your patella is naturally an unusual shape or doesn't fit into the groove in your dash as it should be. Okay. So what is the correct answer there? It is from the unshaped. So which is from text B, the last one, natural shape of your knee. So what about the unshaped? See, if it is an unusual shape or doesn't fit into the groove in your femur as it should, you might develop PFPS. So answer is femur. F-E-M-U-R. Femur. Okay. Then the last one, the follow-up was for dash and 27 of them completed the study. So as you know, the study which is mentioned here. And what about the follow-up? See the last one, left side box. 6 months follow-up. And they have completed. Okay, how many people completed? 27. So answer is 6 months. Okay, so answer should be 6 months. So that's that. Okay, Marin. So did you get the answer for the 20th question? That is 6 months. Okay. So if you have any doubts or any concerns, you can comment. Okay. I'm so happy to rectify your doubts and complaints. Okay then. So that's all about today's session. If you have any doubts regarding our sessions, about the classes, anything, you can contact the number which is mentioned on the screen. And stay tuned for tomorrow, the same time. Thank you.